as the person making recommendations, it's important to be wholly transparent. And that will be the groundwork for the trust that you develop and the relationship you have with that client or patient going forward, which will only make their outcomes better. So I am a dentist by training, and I think one of the easiest ways to make an example out of what we're talking about here is to use a dental analogy. I think a lot of us understand what it's like to go to the dentist. A lot of us don't like doing that. So when I have a patient in the dental chair and we go over options for their care, to me, it's very important to make very clear to the patient that there are always options and the reasons why I'm recommending certain types of treatment. And it's my job as the provider or the person counseling them on their care to be really clear about why it is I'm making the suggestions that I do, and ultimately leaving it up to the patient to decide how they want to proceed with their treatment. And this can be extrapolated, I think, in a lot of different circumstances, not just in dental care, but when you offer recommendations or treatment options or care plans or situations to patients or clients that you think that they should follow, it's going to be really important to make sure that they understand why it is you're recommending things to them. They want to know that you aren't simply recommending them because it's the way you were trained or because a certain article says so. That's not necessarily important to them. Fostering that trust, whether it's with following through on what you've said you were going to do, or it can be as simple as that. You tell a client that you're going to do something, you're going to find them a provider, you're going to try and help them manage, their housing situations, or do the best you can to kind of work them through some of the other circumstances they find themselves in, and you follow through on that.